here with Dr. Kim and nurse practitioner Scheiding at Christie Clinic, and they are sponsoring our segment today, and we are going to be learning the importance of breast cancer screenings and how it's not just for women. So tell me a little bit about that, because I feel like traditionally we think women have to get their annual mammograms and things like that, but it's not just women, right?
I think it's important for all people to have chest awareness, and so and body awareness. So when changes happen, if they feel something or see something, so sometimes it's not even just a feel, but if they're looking in the mirror and they see dimpling, retraction, redness, swelling, one side of the chest is looking different than the other, it's important to have that evaluated.
Yeah, I think it's just good to have kind of, like you said, kind of your own awareness, knowing your baseline, and kind of changes kind of the important thing to kind of keep track of, just because that's kind of the more thing that you're looking out for. Yeah.
And I feel like sometimes your body changes a little bit naturally.
Yeah.
So how do you know when it's something you should be concerned about? And what if, for example, you just had a screening 3 months ago and now all of a sudden something looks different? Do you need another one?
Yeah, so if you had a screening, so screening is only reserved for patients without any symptoms. So it's a kind of a regular routine kind of exam so that we can detect cancer when you're not having any symptoms at all. When you're having symptoms, things to kind of look out for, whenever symptoms kind of come and go, that tends to be more of a benign kind of process. When you're having symptoms particularly related to cancer, those symptoms don't go away. So if you feel a lump, if it's continuously getting worse, that's something to be aware of. But if it, a very common finding is cysts, and those kind of wax and wane month to month. So that kind of thing is a little more reassuring if you have those kind of signs. So.
I tell people too, like if they drink caffeine, sometimes caffeine can cause breast tenderness in a lot of women, or people don't know that. Or if it's related to a menstrual cycle, again, as Dr. Kim said, if it comes and goes and is kind of cyclic, this time of month I always notice it, but then it always goes away. It's something we can talk about, and I'll do an exam and we can decide, okay, do we need to do imaging? But if you have something that is persisting or not going away, causing more things, or even a strong family history, it's definitely worth getting it evaluated. Best news I can give is this is benign and everything looks good.
Don't worry
That's
about
always
it,
a good day when I can say everything. I'm reassured. I think everything looks okay.
Right.
So.
And I will add, if there are symptoms, talk to your provider, and a mammogram will be ordered, but that's not a screening mammogram. I like to differentiate that. It's called what we call a diagnostic mammogram. It's still using the same machine, but we're doing particular images in the area that you're having symptoms. So it's not the same thing. It's very different goals that we have depending on your screening or if you're doing a diagnostic exam.